I'm Ken Farr with the same club, Los Chillos Milenio. Um, I want to present a couple of projects that are much more innovative for our club, and one that's particularly innovative, uh, I think, worldwide. Uh, we've done a lot of water projects and successfully, and one that I'd like to add to that is in the maternal and child health area. And this is in a project in a rural indigenous communities in the Amazon, um, in Cantontena and these communities of Ahuano and Chontapunta. These are about 6-hour drive from Quito, so it's quite a ways. Culturally very different, language issues. Ministry of Health doesn't reach these areas very well, and particularly now, as Terry has mentioned, the country in its situation of economic crisis, security crisis, expecting government programs to do innovative things in rural areas is quite difficult. One might expect this is a government responsibility, but it simply is not happening. And behind this project is the fact that Ecuador has one of the highest rates of teenage pregnancy, as well as a high rate of young child malnutrition. And so this project tries to address that in a small way, through various actions. So the focus is on about 500 mothers, 250 mothers and 250 babies that will either be born or have recently been born. Basically, go to the next slide. The total cost is on the front page, is about $55,000 with 500 direct beneficiaries. We're talking about $100 per person, sort of the direct beneficiaries. But as we will also point out, there's a lot of training of the community to get the community leaders and parents and husbands and so forth involved in understanding the issues of nutrition, family planning, child health. Can go to the next slide. Well, this is kind of just a routine stages of implementation of any project. We've already done a basic needs assessment in the sense of coming up with how many expected pregnant women in this area. So the kind of the needs assessment, and then organizing in phase 2 the team that'll be doing training and organizing the project, beginning in the phase 3, kind of really being the training program and communication program, and sort of phase 4 continuing on with that through the media. So what are those activities? I think the next slide. So here's the yeah. So the major goals will be to really evaluate and follow up and control for both the pregnant mostly are teenagers, unfortunately, and assessment and follow up and control for these children born to these women for at least 6 months. It's kind of standard things that should be done and are done in a well-equipped community, but these are rural communities, so there will be expenses of some minimal amounts of equipment in these health centers. There's a rural health center there, but a lot of the activity will be providing trainers to educate in their own language these others about proper nutrition, breastfeeding, and nutritional supplements, both particularly for the mothers during pregnancy, and perhaps some of these children who are either not able to breastfeed or needing supplementation. So the kind of training that's needed for that is sort of the basic part of the project. I think there's a bit of funding for the nutritional supplementation. This is also a bit of an incentive for getting people to come to the program. If there's some food available, it's something that will be also an attraction. Now, the idea is that this the training will include Ministry of Health personnel as well as leaders in the community and the parents of these children. So we're hopeful that that will lead to a longer term, more effective raising of education of mothers during pregnancy and taking care of their children as this goes on in after this project ends. I think those are, the basic issues about this program. To say it's not that much money per person, but we think it would make an impact in an area that otherwise is not reached very well. One might question why are we doing something so far away from Quito? I've questioned that myself. The needs are there, and we happen to have one particular person who was head of our project, Rotary Foundation, who couldn't be here today, Francisco Escudero, who has worked with this community a lot in the past and who has led us to do other projects there with the schools. So we have a longer term relationship in that area and a commitment with those communities already established and people in our club willing to make those trips out to the field. So these are a map which doesn't mean too much to you from those living outside Ecuador, but as I say, it's about a 6-hour drive, so it's quite a hike to get there. But we have made a commitment to work in those areas before. So I think that's. Any question? The expert on this project, unfortunately, is not here today, but Francisco's email address, I believe, is in one of the slides, or we will provide.